To start off, make sure the subject's feet are firmly on the ground and that their arms are resting on a flat surface at heart level for 5 minutes. Next, grab your blood pressure cuff and make sure that it's the correct size. Diagrams are often shown on the cuff as a reference. Next, locate the brachial artery line on the cuff as well as the range where the subject's arm should be placed. For this demonstration, a switch release will be used, but keep in mind that knob releases are common as well. What you want to do next is grab your stethoscope and make sure that it is working properly. Clean the earpieces before inserting them into the ear canal and make sure that the earpieces are pointing forward. Once inserted, gently tap the large circle of the chest piece and ensure that the tapping is heard. Once you've completed all those steps, you are ready to take your patient's blood pressure. Bare arms should be easily exposed, therefore long sleeve clothing or sleeves are not recommended. Snugly wrap around the cuff on the patient's arm and align the brachial artery line over the brachial artery. Leave approximately 1 inch of space between the upper and lower arm, as that is where the chest piece will be placed. What you want to do next is place the index and middle finger over the large circle of the chest piece. Place the large circle directly underneath the cuff, termed antecubital space. You can then start pumping the cuff up to 200 milliliters of mercury. Once you reach the desired pressure, start slowly releasing the pressure at a rate of 2 to 5 milliliters of mercury per second. Now listen for an initial muffling sound. This is called the systolic blood pressure. Keep listening until the muffling sounds disappear completely. This is symbolized by the diastolic blood pressure. Blood pressure values are given as systolic blood pressure over diastolic blood pressure. Before starting the procedure, the subject should be notified to not consume caffeine or nicotine at least 30 minutes before the measurement. Once systolic and diastolic blood pressure values are obtained, they can be categorized into one of 5 classifications. The classifications range from low to stage 2 hypertension, with normal, prehypertension, and stage 1 hypertension falling in between. Depending on the range the given values fall under, lifestyle modifications might be recommended. Reason being is due to the high correlation between values in the lower and upper extremities and various health disorders.